Being newly diagnosed with breast cancer is a scary process. Let's hear what the advocates share with the newly diagnosed patients. Dale Eastman, share with us, you and I both know what a scary event this is. It's a life-altering event, being newly diagnosed with breast cancer. Not only you personally as an advocate, but your Alamo group and other advocacy groups, what kind of advice, what kind of help can we give the newly diagnosed patient?
Well, just for myself, I can tell you that when you're newly diagnosed, it's a very frightening experience. You know that because of breast cancer awareness campaigns that are out there, you know that it's out there, but you think, oh, this is never going to happen to me. And then, lo and behold, it may happen. And then you have to consider having a disease that could very well make you very ill, or maybe you might even have to consider your own mortality, and so you become very frightened. So my suggestion is talk to somebody that's been there. They can help you through it. There are many organizations now across the United States of breast cancer advocacy groups, breast cancer support groups. Search them out, talk to somebody that's been there. They want to help you. The ones that are part of these organizations want to help you. There's also a lot of information out there, a lot of books, and educate yourself so that you can be an informed consumer when you go into your doctor's office, and in that way you'll better understand what they're going to tell you, what your treatments are going to be, what you're going to have to go through. And bring somebody with you.
Oh, really important advice about
Right.
bringing somebody with you, because the average patient,
Right.
Dale, can barely take in 10%
Absolutely.
of what we're telling them.
Right.
And even their accompanying spouse or good friend has difficulty in taking it in. And I think you're also advocating that the newly diagnosed patient, as best they can, should become a student of their own disease.
Absolutely, you have to be an advocate for yourself.
Right, absolutely.
And you may even hear about several different treatment options. Go for a second opinion.
Sure.
And you're going to make the final decision. And you should make the final decision between yourself, your husband, or if you don't have a husband, maybe a really good friend you might want to talk to. But the final decision really has to come from yourself. But if you've kind of educated yourself a little bit about the disease, then you should be able to make that decision.
So let's also advocate for multidisciplinary care. The treatment of breast cancer is a team effort,
Right.
generally involving surgeons, medical oncologists, radiation oncologists, all sorts of other team members. And really, typically in this day and age, we're offering options to patients.
Absolutely. And you're going to have to think about not only treatment, but what kind of surgical option. You might want to say, oh, I got to choose between lumpectomy and I have to choose between a mastectomy. Which one will I choose? But if you start to educate yourself about it, you'll come to that decision.
Right,
and you'll feel good about it.
Yep, and people also need to know, one of my favorite mantras is, time is our friend. In other words, the patient thinks, oh my gosh, I've got to have treatment day after tomorrow. And they don't, because it takes time to figure out what all the options are. Now at Alamo, do you also have a crisis line or a phone line that,
Absolutely.
that people can call?
And there are helplines out there. We have one locally, and we will match them up with people that might have the same, because there's so many different breast cancers. I mean,
That's right.
we'll match them up with somebody that they want to talk to somebody that's had a lumpectomy, somebody that's had radiation. What do you do when you lose your hair? Am I going to be sick? We can match people up to talk to them.
Very good.
Yes, and we can also send them resources. We have a lot of resources to send them. There are national helplines, so that if there's also Susan G. Komen has helplines.
Right.
So there's a lot of availability out there for their support.
Great. So to wrap up, for the newly diagnosed patient with breast cancer, there are a lot of resources out there. Check out organizations like the Susan G. Komen for the Cure, the American Cancer Society, your local advocacy groups. The resources are there for you.